Hello, I'm Dr. Michael Kessler, and I want to welcome you to what I think is one of the most important of the modules. And this is going to help you in so many ways in your practice, okay? So we're going to go over some of the important calculations you need to know to calculate the Cardiovascular Risk Index and the quadrants, and we'll talk about that, okay? And here we go. So this is the disclaimer. We always got to do the disclaimer. So this workshop is for educational purposes only. It does not replace clinical judgment or individualized patient care. It's not medical advice. The information presented is for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Use clinical judgment. Each patient is unique. You're responsible for using your own clinical judgment in evaluating and treating your patients. This is not a substitute for standard care. The concepts and tools presented are intended to complement, not replace, established standards of care in evidence-based medicine. Results may vary. Outcomes depend on many factors, including patient adherence, lifestyle, and individual physiology. Results are not guaranteed. No endorsement. The mention of any specific products, labs, or technologies does not constitute endorsement. Use what is appropriate and legal in your practice. Your license, your responsibility, your patients. Thank you for committing to safe, responsible, and ethical practice. So with that said, we got that done. All right. So we're going to show you some of the calculations. Now, this video that you watched before that explains the cardiovascular risk index, or actually explains what is causing those vessels to become stiff and non-flexible and all that good stuff that we talked about, the returning wave and the forward wave and all that, is calculated here. So you can be able to probably, I would say save some lives and be able to prevent problems way beforehand. So the cardiovascular risk index calculation has changed. So this is the change that I want to go over with you. Okay, so we have an updated formula and you'll be right on and accurate. So please use the new cardiovascular risk index calculation, not the one that you saw on the video previous to that, okay, to this. So you're going to measure, like the pulse pressure, and that's, systole minus diastole. And if it's over 60, they get 15 points. Those are points you don't want to have, actually. It's not a gift, right? LF percent greater than 60 equal 15 points. Stress index greater than 100 equal 15 points. Stress index greater than 100 equal 20 points. It's a big marker there, and it's known as a big cardiovascular risk factor, right? The stress index. SDNN less than 50 equal 15 points. RMSSD below 20 equal 10 points. Total power less than 1500, they get 20 points, okay? So, and then you take that number, you get a total add up, right? And then here's where you get a look. If it's 0 to 29, it's a low risk, better adaptability, and lower cardiovascular stress burden. But if it's 30 to 59, it's a moderate risk. Early signs of physiological stress, reduced adaptability patterns, and you want to start doing something if it's a moderate risk right there. You don't want to wait, right? 60 to 100, high risk, significant stress burden, reduced physiologic reserve, and reduced autonomic nervous system adaptability again, okay? So here it is. We just talked to you about it. We've already updated you with the new way to calculate. So what we want to look here is below why these parameters, why do we use these parameters, and you can read that on the left, but it all comes from the research. We just didn't make this stuff up. Pulse pressure in the literature, if you look there on the right there, it says arterial stiffness and increased cardiovascular disease risk. If you look at LF percent and it's greater than 60, we're talking about sympathetic overactivation and elevated blood pressure regulation stress. Because remember, the LF is tied into the baroreflex system that regulates and controls blood pressure. Okay, and so when that system is a little bit stressed, it's going to call on the LF to compensate for that, and then we see a big yellow pie, and we have to always combine that with looking at that pulse pressure and some of the other parameters below. Stress index greater than 100, autonomic nervous system overload, and reduced autonomic flexibility. SDNN, is a big one, and it's lower than 50. It's associated with higher all-cause mortality and cardiovascular events. So we put this together in a way that ties in all this research, right? RMSSD, lower than 20. Reduced parasympathetic, vagal activity, and cardiovascular risk. How about the total power below 1500? Reduced physiologic reserve and overall adaptability. So you kind of put it all together. No single marker defines risk. Cardiovascular Risk Index combines multiple physiologic stress markers into a single cardiovascular resilience score. There you go. So here we have on the website, if you go to brainbodysync.net, you can download this information right here so you can fill it in, so you can calculate out. You can see on the bottom there, it has systole and diastole, and you subtract that, you get the pulse pressure, and you can look what the number is, and it kind of tells you right there, is it below, or is it optimal, below 40? Is it borderline? Or is it increased vascular stress when it's above 60, right? And on the right, you have all the indices from the HeartQuest professional, right? And you're gonna, each one of those gets a specific score. So you can look at that, and if the LF is the optimum, if it's below, if it's over 40 to 60%, it gets a specific score, I believe 15. We'll look on the next page. HF, if that's lower than the 15 to 30%, it's going to get a specific score, right? The stress index and so on and so on. So those are the ranges, and it is calculated here. Let me go here for you. Let me keep going. That's the vascular, what are you going to do about it, once you have these issues? And, we like, in the vascular support section, when there's an issue here, we like to use US enzymes. You can use anybody you want. I use Therazyme, Cerazyme, Natozyme. And if it's not too bad, I may just use Lumbozyme. But if it's bad, if it's a high-risk score, I may use all three. Sometimes I'll use a nitric oxide support if appropriate. I may use omega-3 fatty acids, CoQ10, mitochondrial support, and I may use some minerals, all those things to support the cardiovascular system. But never forget that stress, we talk about this a lot, but all sorts of, whatever the stress is, right, is going to affect the vascular system. And so we want to reduce that. So sleep support, using your neurovisor, manage stress using our neurovisor. One of them we like is managed stress routines and peaceful heart. And we like sometimes vagal nerve stimulation, electrical stimulation. Breath work is really good. Anti-inflammatory diet, that makes a lot of sense, right? Safe exercises guided by a health professional. If you're not, accustomed to training, and, we don't want you to overtrain. We want the right there in the Goldilocks zone. With plenty of rest time in between training, adaptive conditioning when appropriate, hydration support, stress recovery, and pacing. Again, like I said, you train, and you also, just as important as training is the recovery time, right? And so we also look at the emotional component, okay? And so when we're looking at a high cardiovascular risk index, we also want to handle this aspect, right? And so I like to use the Ruby-Med remedies, individualized support addressing specific energetic psycho-emotional patterns that may create repetitious patterns in life that may not be desired. Where you keep repeating the same things in life over and over again, we want to kind of break those patterns. NeuroVisor is really helpful with that. So I like stacking the deck with all these different modalities. Over time, these patterns may affect the physical body, and that's usually most of the time, right? For those who do neuroemotional technique from Scott Walker, that's a wonderful technique. EMDR, thought-filled therapy, or you just, if you're, skilled with all this, it's nice to combine everything, right? So this is for research and education, wellness support only. This form is not intended to diagnose, treat, cure, or prevent disease. Again, we say use clinical judgment and refer to appropriate medical evaluation when indicated. Anyway, so all these, this document, this document, this document, this document, they are all on this website, okay? In the documents section, you can always find things in the documents or the questionnaire section, okay? And there you have it. You can print it out and calculate this out for your patient. The next area that we think is important is the quadrants, okay? And the quadrant system provides a visual map of the autonomic balance and cardiovascular stress. It is based on two key dimensions. So the two key dimensions really are something called the emotional load index and the ARI, which is the autonomic resilience index. And this takes a nice global look at all the parameters on the HeartQuest and places your patient into one of these quadrants, okay? Are they overwhelmed? Are they compensating? Are they exhausted? Are they thriving? And obviously we want to get them to the quadrant 4, right? And so if they're in quadrant 1, they have a high on emotional burden, emotional load index is high, and the autonomic nervous system, low adaptability, low ARI, autonomic regulation or resilience index. So there you see that in quadrant 1, high ELI, big emotional burden, low ARI. So the autonomic nervous system is kind of a little bit deficient, right? And we're going to handle that person a little bit differently. And quadrant 2, wow, they have a really robust autonomic nervous system, but a high emotional load index. Quadrant 3, these people are exhausted, and we can break it down into 3 different stages of exhaustion. Okay, in this, and they got a low emotional load index, excuse me, and they have a low autonomic resilience index. Okay, and so what you're looking for, what's high, what's low, and you'll be able to know what quadrant they're in. And when you calculate it, you'll be able to see, again, like for example, in quadrant 3, it's a low emotional load index and low autonomic regulation or resilience index. I always forget that, right? And thriving, low burden all around. They have a low emotional load index, so not a big thing on the emotional side of things, and a high autonomic regulation index. So they're thriving, right? So each quadrant represents a distinct physiological state that helps guide interpretation and individual action. So, the quadrants really are a big deal. And the quadrants turn complex physiologic data into actionable clinical insights, which we'll show you. And we have an actual flip chart. Some of the practitioners have that. So when they calculate that, they can use the flip chart. It has information about each of the quadrants and what is the best avenue or action step to take based on that quadrant, right? So it's quick insight, provides at a glance view of the autonomic balance and stress burden. Personalized interpretation helps identify the dominant pattern driving a person's physiological state. Guides clinical decisions, supports targeted intervention based on the individual's specific needs. Tracks progress. Shows movement and shifts over time as the body adapts and responds to intervention. So like I said, maybe they're in quadrant 1, but we want to get them into quadrant 4. That would be a good thing to do, right? Improves outcomes. Using the quadrants help practitioners create more effective, measurable, and meaningful care plans. And we'll show you that in just a minute. So the quadrants help connect the data to the person so you can take the right action at the right time. So again, we break it down and we get so many points here for if the stress index. So we have a questionnaire, and you can get that also on this website in the questionnaire section, and you have them fill that out. It's also in the HeartQuest now. So you could actually, you have it right there. And if it's over 20, it gets 2 points, right? And the other thing that we look at, and you can see down below, the stress index is greater than 100, gets 2 points. Polyvagal positive. So in that, it's on your nervous system screen. All three of those vertical lines in the polyvagal section have to all be in red for it to count. Okay, it can't be 2, can't be 1. All three show up in there, and that gets 2 points. VLF, if it's greater than 40, it gets 1 point. And so you can add that up. And what you want to know, if the ELI is low, okay, so if it's over 2 plus, 2, 3, 4, then it's going to be in the high zone. So you just need to know if it's low or high. Emotional load is more than how someone feels. It's the burden placed on the autonomic nervous system, right, from that aspect. So then we go over to the other side. How is the autonomic resilience index doing? And we're going to look at that. And we're going to go, okay, here's the major markers, SDNN. If it's less than 40, because we want a really high SDNN as possible, it's 2 points. RMSSD, if it's less than 25, it gets 1 point. Total power, if it's less than 1500, it gets 2 points. LF, if it's less than 15%, gets 1 point. You add them up, right? And now you know if the ARI is high or low. All right, so you can know what quadrant you're dealing with here. So there's the interpretation. They also have below, if the HF is lower than 15%, it gets 1 point. If you got a high if you got an HF, you're talking about the green pie, right, on the HeartQuest Professional, and plus a total power that's lower than 1500 or lower, it gets 1 point. Okay, and then you add them up. And you can see in the interpretation if it's a high ARI or a low ARI. Excuse me. So resilience is the ability to adapt. The goal is improved autonomic nervous system adaptability. And there you have your quadrant. And here on the website, you can download this. And this kind of puts it all together for you. So you can calculate, again, if the ELI, emotional load index, is low or is it high? So you can, and the same on the other side, you can fill in and score it, and you can look at the quadrant assignment down below. High, low, high, high, low, 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 high, and what quadrant that puts that person in, and the clinical meaning of that. Very important, because you don't want to be pushing somebody hard in quadrant 1. You want to go gentle with them. And we're going to show you some suggestions, right? So there's the quadrant. Quadrant 1, high emotional load, weak regulation, right? High emotional load index and low autonomic regulation index or resilience index, either way, right? So you can look at that. So quadrant 4, here it is. Some more information for you. These are some suggestions and some guides for you about, like I said, if they're in an overwhelmed state, high burden and low adaptability, calm the stress response, breath training, HRB. Well, this is mostly it would be a breathing program that you would use. So where it says HRV biofeedback, just getting them to do diaphragmatic breathing would be really good. You can get them to meditate and get them to sleep. If I have trouble getting them to sleep, what am I going to use? I'm going to use the neural visor, and that's going to start to train that so we can improve their circadian rhythm, right? It has here reduce nervous system load, reduce stimulants, manage overtraining, pace daily activity, so they're not pushing and doing too much. Address inflammation and nutrition, antioxidants. So these are some general, excuse me, these are general quadrant information here. Quadrant 2, support resilience and efficiency. Breath work again, optimize performance and recovery. So you can kind of look through here, okay, what things you might want to do. But remember, in quadrant 3, they're pretty tired. They're pretty exhausted. So whatever you do, you want to tonify, bring that energy up, use mitochondrial kind of things, rebuild their system. So this is a little bit more targeted here for you. So if you're in quadrant 1, calm the autonomic nervous system, reduce psycho-emotional burden. I like to sometimes use the Stress Buster kit. Sometimes I'll use the Ruby Med. Sometimes I'll use both because they have a high emotional load index here. Establish proper digestion and absorption. That's true for almost all the quadrants. Open drainage pathways first. Some of you have our new flip chart, which is amazing to show your patients and explain drainage and explain the extracellular matrix and how things get backed up in the system and why you're doing drainage remedies and doing things to improve their digestive system. And so that's a great flip chart for you. Improve sleep and recovery. Reduce inflammation and oxidative stress. Start slowly. Avoid aggressive detoxification. That's a quadrant 1 person. Quadrant 2, you're still going to, they still have a high emotional load index. So you're going to still do some of the same things we talked about. That's right here. Stress Buster Kit from BioResource, one of the Picana line, which we really like because we've done some testing with that. We can show that to you if you ask us. Address hidden stressors before exhaustion develops. Okay, so again, the Ruby Meds is really good. Use your neurovisor. Establish proper digestion and absorption. Improve efficiency and recovery capacity. Support mitochondria and cell membranes. Moderate detoxification and drainage. Build resilience while preserving reserves. So, these are just some ideas for you. And the quadrant 3, that person has a low emotional load. And they have a low autonomic regulation index. The main one is their nervous system. Their autonomic nervous system is kind of not working so well, right? It's kind of trashed. And so restore physiologic reserves again. Establish proper digestion and nutrient assimilation, nutrient replenishment, support mitochondria and cell membranes. Consider thyroid and adrenal support when indicated. Gentle movement, recovery stages. Again, make sure they get plenty of rest. Avoid overtreatment. And the last one, you want to maintain that person so they don't backtrack. They're doing really, really good because they have a low emotional load and they have a high autonomic regulation or reserve index, which means just basically they have a really good, strong autonomic nervous system, right? And again, always maintain digestive health and microbial balance, right? You just want to maintain that where they're at right now because they're in a good place. We don't want to let them slip. So you can read the rest of that, right? So again, when they're overwhelmed, this is what we're looking at here. Calm the autonomic nervous system, reduce the psycho-emotional burden, establish proper digestion, absorption, open drainage pathways first, support lymphatic flow. We find that in most people, their lymphatic system is not working as well as it should. That's your body's sewer system to get rid of the waste, right? Improve sleep and circadian rhythms. Again, I said it and said it again. Use the neurovisor. It works. Start low, go slow. Don't push harder. Reduce the burden. First, calm the system, then restore balance. Quadrant 2, here we go. High emotional load plus high ARI. We're talking about reduce the psycho-emotional burden again, address hidden stressors before exhaustion develops. What's already entrenched. We just don't want it to go further. Remember that there's stages that you can measure in here in these quadrants. In quadrant 2, what stage of exhaustion they're in, right? establish proper digestion and absorption, improve recovery efficiency, support cell membrane mitochondria, moderate detoxification and drainage, build resilience while preserving reserves, prevent progression to quadrant 3. Excuse me. So quadrant 2, I was thinking, I don't know in my head, I was thinking quadrant 3. So this person, they have a good autonomic nervous system, right? Their nervous system is working pretty good. Actually, the high emotional load. I'm blanking out here for a second. Give me a break. High emotional load. So they have a high emotional load, and they have a high autonomic regulation index. So the emotional load is still high. We have to address that psycho-emotional load in that person. That's why reduce psycho-emotional burden, stress buster kit. But you can go a little harder with this person because they have a better or more adaptive regulation system from the autonomic nervous system in this one. Quadrant 3, I was thinking quadrant 3. So you look on the right there, quadrant 3 has quadrant 3A, quadrant 3B, and C to all the way to advanced exhaustion, right? So you want to restore physiologic reserves, you want to establish proper digestion and nutrient assimilation, nutrient replenishment. Maybe those are the B vitamins, I like to use liposomal to get them in. Support mitochondria and cell membranes, big deal. Support thyroid and adrenal function when indicated. Correct mineral deficiencies. Gentle movement and recovery strategies. Avoid overtreatment and avoid excessive detoxification. You got to be gentle here as well. You can't detox your way out of exhaustion. Restore before you rebuild. I thought that was good. Thriving. Quadrant 4. Just got to maintain that person, and make sure, again, I say that you don't want them to backtrack. They're in a good place here. Maintain digestive health and microbial balance, maintain resilience, optimize performance and recovery, exercise and muscle maintenance, prevent regression, support healthy aging and longevity, continue health lifestyle habits, maintain social connection and purpose, fine-tune the physiology here. You can go hard with this particular person, or you can do what you need to do with them without worrying about having these detox type reactions. And there you go. This is the stress index questionnaire. You'll find that on the website in the questionnaire section. So make sure they fill that out. We have the numbers there. 1 is rarely, 2 is sometimes. Add it up and you get a score. And this is going to be calculated into your emotional load index. So remember, we have the two sides, what's high and what's low, and that's pretty easy to calculate. Subjective stress matters. Emotional load is not just what the autonomic nervous system is showing, it is also what the person is experiencing. So you go ahead and score that. And that's the rest of it. Right? There's actually 10 questions. And then you could take the total score and you could look below it, the interpretation. Where are they? Is it a very high emotional load index, right? Or is it low? So the ELI combines what the person feels with what the autonomic nervous system is showing. We added something else. This is brand new because we know that VLF is pretty broad, right? It has a lot of information in that red pie that could represent a lot of different things, from high emotional load, excuse me, to inflammation, metabolic issues, and a lot more. So sometimes we want to isolate that, okay? And in the next section, if I do the VLF, pay attention to the trending screens that I show with a particular case, because that is so valuable to trend somebody and to trend all the parameters on the HeartQuest, and you'll be able to see what I wasn't able to see before. It really enlightened me in a case that I thought the person was just going downhill. But when I trended it, you can see all the numbers were trending up. All of them. SDNN, RMSSD, total power, stress index were going, and the stress index was trending down, which is really good. Even though the scores weren't the best, but they were getting better because this person was really having some really serious issues. But the VLF kept going up, and I know it was an emotional situation, which we'll show you, and that will drive, that emotional stress can drive that red, like we see here in the VLF, right? And so that was one component that we needed to add in. And on this questionnaire, what's the first one here? Do you feel overwhelmed? Number one, stress and emotional loads. You can fill that out just so you have a fill. There's the sleep and recovery. Is that maybe some things that are going on with this person and that can be improved? How about inflammation and physical health? Really a big deal, and you can read through that. Lifestyle and behaviors. That's a good one to look at because you want to know what's driving that VLF. And it's not usually just by itself. It's VLF and maybe total power and stress index and all those other things combined. And then you can look at the last section there. So we have that on the for you to download. Excuse me. So when VLF percent is elevated, use history and targeted testing to uncover root causes and guide a personalized recovery plan, right? So it allows you to be a better detective here, and it just has these things broken down again for you, and you can kind of check those things off, right? And here it is. Another section here, and you kind of look through that, things that could keep that VLF elevated. Commonly appears, it's not a diagnosis, but commonly appears these patterns of chronic stress, anxiety, depression, burnout, PTSD, neurological disorders, chronic inflammation, long COVID, sleep disorders, overtraining, cardiovascular disease. You'll see, most likely, you'll see a pretty good size red VLF, right? Excuse me. So the things that keep it elevated, again, psychological, environmental, biological, lifestyle. So you want to know what's preventing them from recovering, right? And again, never look at one thing. So high VLF requires context. VLF never stands alone. Look at total power. Look at the stress index. Look at pulse pressure. Look at blood pressure. Look at symptoms, history, labs, and emotional load. Really big deal is follow that trend. When I show that to you, excuse me, in the next episode, if I put it in there, it will be on VLF. That is something you really want to see. It will kind of wake you up because a lot of times we look at the full HeartQuest professional and we come up with our, wow, that looks bad, and all the main parameters are not looking good. But then you look at the trending and you trend. The ones I trend, by the way, I trend VLF, I'll trend total power, I'll trend the stress index, and I'll trend SDNN and RMSSD. And I do them separately. I don't like to do them all together because then I got a bunch of lines. I want to see those lines over time. And this is a person, when I show it to you, has done the HeartQuest many, many times, and you'll see that whole trend over time. That's pretty powerful. Trend matters more than one reading, right? The goal is not to normalize VLF. The goal is to improve recovery. As recovery improves, as the stress load falls, as inflammation falls, adaptation improves, VLF often changes. Resilience returns. Treat the person, not the number. I'm sure you've heard that before, right? So here's the VLF clinical roadmap. Excuse me, throat's dry here. We're in Arizona. It gets pretty dry. High VLF percent. Start asking questions. Identify the stressors, confirm with history and testing, remove barriers to recovery. That's what we try and do. Remove the causal factors, right? Recheck HQP, follow the trend. VLF is a guide to clinical thinking, not a diagnosis. Putting it all together. High VLF suggests your patient's slow integrated recovery systems are under strain. Really, what we're talking about is it's usually chronic stress. The red pie is usually chronic stress. And when we talk about it, it's slow system where we talk about snail mail versus fast speed internet, which is your the yellow pie and the green pie. That's your autonomic nervous system. It goes right out to your target organs. It's very quick response, right? That nerve, by the time it gets to the target organ, it's traveling at 10 to, I think, 150 milliseconds. It's fast. But the VLF, it's coming from the HPA axis, from the brain all the way down to the adrenal glands, putting all those hormones into the bloodstream to regulate before it gets to the adrenal glands, where the pituitary releases ACTH, triggers that from the stress response from the brain. Very slow. It uses a lot of energy. So we always talk about VLF is a big drainer, right, on energy. And I think that pretty much is all I want to say on that. And I liked one of my favorite docs, out there. He teaches at Stanford. He's one of the professors there. He wrote the book Why Zebras Don't Get Ulcers. That's Robert Sapolsky down below there. It's not the stress that kills us. It's remaining stressed, being stuck, not letting it go. Okay? And I want to thank you for listening. I think this is going to be another really important lesson for you. And I want you to go ahead and download all the materials we have for you and give us a call. Let us know how this is working out for you. Thank you.